Hello, Dr. Vicki Peterson here. I wanted to talk to you today about a new study that just came out actually a few days ago having to do with celiac disease and autoimmune disease. We've talked about autoimmune disease quite a bit, but I think it bears repeating, especially when new studies emerge and they really corroborate not only what we've said in the past, but really the urge for those who are diagnosed with diseases that are more easily diagnosed and related to celiac disease, that they know about this correlation. The diseases of an autoimmune nature that are most associated with celiac disease are autoimmune thyroid disease, liver disease, type 1 diabetes, psoriasis, Sjogren's, what am I leaving out? And dermatitis herpetiformis, which is the skin manifestation of celiac disease. So all those diseases are known to be very associated with celiac disease. Now, we're pretty good at diagnosing thyroid disease and liver disease and type 1 diabetes, not so good with dermatitis herpetiformis. It kind of falls into that same category as celiac, which we don't diagnose it very well at all. But the other diseases are much better diagnosed than is celiac disease, and so very often patients are diagnosed with those, are suffering with those, and they don't know that they're much more at risk for celiac disease. And several studies show a nice correlation between getting on a gluten-free diet and resolution of some of these autoimmune diseases. There was a study having to do with autoimmune hepatitis, which is the autoimmune liver disease, and with both adults and children, they saw a complete reversal of the disease after 1 year of being on a gluten-free diet, which was huge. There was another large study, this was done back in 2000 in the Journal of Pediatrics, and they looked specifically at type 1 diabetes and the autoimmune thyroid disease, and they found that when the children were put on a gluten-free diet, within 2 years, all of their antibodies normalized. So the antibodies are ones that show that the body is attacking self. So there's antibodies against the thyroid and antibodies against the beta cells of the pancreas, which is what's seen in type 1 diabetes. So those are very exciting studies, and there's one more in 2008. This was published in the clinical journal, of Gastroenterology and Hepatology, so having to do with the GI tract and the liver. And what they found out, this was done in over 900 individuals, that the patients who were diagnosed with celiac disease and were compliant on their diet were much less likely to develop other autoimmune diseases, because celiac disease in and of itself is an autoimmune disease, so they were much less likely to contract another autoimmune disease as compared to those patients who were not compliant on their gluten-free diet. So there's a very large and rich association between celiac disease and other autoimmune diseases, as I mentioned. And I think the biggest thing to know, and sort of the teaching moment, is that if you know of individuals with autoimmune disease, or you yourself have a strong autoimmune family history, look for celiac disease. Very often in these studies they noted that there was not only an increased risk of celiac disease, but that it was of the silent variety, so patients didn't necessarily have symptoms. Just because you don't have symptoms doesn't mean that the small intestine is not being destroyed, and it doesn't mean that you're not at risk for all the various diseases and conditions associated with untreated celiac disease. So there is an entanglement here that's very apparent. More studies, of course, need to be done, but the correlation is pretty clear. And the more stress you can remove from your body, the better it's going to be, the better it's going to heal. We've certainly seen some nice reversals as well as stabilization of autoimmune disease here in the clinic. And autoimmune disease is on a huge increase in our society. It's doubled every 15 years for the past 75 years. This is way too important of a part of our healthcare to not really see any correlation that could make a difference. So celiac disease definitely seems to be tied in. Gluten seems to be tied in. So please share this with those you know who are suffering from autoimmune disease. And once again, if you have autoimmune disease in your family, get tested for celiac disease. Get tested for gluten sensitivity, which opens a whole other can of worms. We don't know the correlation of those who are gluten sensitive perhaps developing autoimmune disease, but that protein in those grains, wheat, rye, and barley, that we call gluten, is not digested by any human properly. It's very high in the amino acids called proline and glutamine, and because of that we're not able as humans to fully digest that protein. And then of course for some of us our body really attacks it as if it were a toxin, and that's really the same in gluten sensitivity and celiac disease. Yes, the attack manifests itself differently, but the fact that we are intolerant to gluten, that part is the same, and there are a myriad of symptoms associated with it. So there could definitely be, I've seen it here in the clinic, and my fellow clinicians here at the clinic have seen a correlation between those who are gluten sensitive and autoimmune disease. So more needs to be done in the area for sure, but if you're in that position now, at least find out if you're sensitive to gluten. Get tested. Even if your test is negative, do that test first, certainly, if you can. But even if the test is negative, there's absolutely nothing wrong with putting yourself on a 30-day gluten elimination diet and see how you do. So I hope this was helpful. Until next time, I wish you very good health, and please send me your questions and comments. I do love to hear from you.